Hello, everyone, and welcome to. Thanks for joining us on today's webinar. My name's Lisa Waters. I'm the CEO at NatCan. But before I begin today, I'd like to acknowledge the traditional owners of the land that I'm joining from today, beautiful Gumbaynggirr country, and acknowledge elders past and present. I'd like to welcome everyone from the lands that you might be joining from today and acknowledge any First Nations people joining us today. It's also really important to acknowledge all of the Aboriginal and Torres Strait Islander children, as that's where this strong and proud culture will live on. A few housekeeping items to start. All of the webinars will be recorded and posted on our website in the coming weeks. The chat function is enabled, so for questions, please feel free to submit them throughout the webinar. We'll endeavour to answer as many questions as we possibly can. You can find the chat and the question function at the top of your screen. The webinar is in listen-only mode, so you're all muted except for the panelists. Closed captions are available by clicking the CC down the bottom of the screen. If you experience any issues, please refer to the frequently asked questions posted in the chat or contact the phone numbers or emails provided in the chat. This year, National Child Protection Week continues to champion the message that every conversation matters. Building on this, the campaign highlights the importance of shifting conversation to action, recognising that dialogue is the first step, but meaningful change comes when these conversations lead to safer, more supported lives for children now and into the future. We are just 4 days away from the National Child Protection Week, but this webinar series began early. We launched our first webinar in NAIDOC Week because we know child protection is not a week-long conversation. It is an everyday priority. And I'm delighted to see so many people live joining us from across the country today. So today we're going to be shining a light on frontline voices, especially from remote and under-resourced areas, and share some powerful insights from Numinia's latest research. Together, we'll discuss some of the biggest workforce challenges our sector is facing, from burnout and recruitment to cultural safety. Just as importantly, we'll showcase some practical community-led solutions and innovations that are shaping real change. Today's discussions will explore issues relating to child protection, including topics such as abuse, neglect, and the challenges faced by children, families, and frontline workers. These conversations may be distressing or triggering for some people, so please take care of your wellbeing, step away if you need to, and reach out if support is required. If you find yourself needing immediate support or someone to talk to, NatCan has some staff behind the scenes who are readily available for your support. The support phone numbers are also in the chat. Thank you for being here with us today. So I'm going to start by getting to know introducing our incredible panelists. I'm going to start by I'm going to ask them to introduce themselves. I'm going to start by throwing to Jeanette Kerr. I've had the privilege of working with Jeanette over many years. She is a very skilled executive in the public sector, and we're really fortunate to have her here today. So, Jeanette, can you just tell us a little bit about you?
Sure, thanks, Lisa. That was a very generous introduction. I'd just like to acknowledge that although I live on Larrakia country, I'm meeting you here today from Wurundjeri Willen country in outer Melbourne. And I'd like to acknowledge elders past, present and emerging. A little bit about me. I moved to the Northern Territory in 1988 to join the police force and ended up with a 29-year career there. Worked right across the Territory, regional and remote, and then left in 2016 as an Assistant Commissioner to become the Deputy CEO of the newly formed Territory Families. And there I spent 8 years responsible for child protection, out-of-home care, youth justice, family support and domestic violence prevention. Still living in the Territory, still loving it, still very passionate about, child protection, youth justice, and having really intervention and prevention-based, early intervention and prevention-based strategies and initiatives that are community-focused with children and families at the centre. Thank you.
Thanks, Jeanette. She's been incredibly busy, and we're really fortunate to have you here today. I'm going to now throw to Ursula. I have had the privilege of working with Ursula and learning from her and her two sisters as a young caseworker and manager. And I will be forever grateful for those wisdoms that those strong women shared with me. But Ursula, over to you just to talk a little bit about what you've been doing in your career.
So, as Lisa said, I'm Ursula Donoghue. I'm an Aboriginal woman from Dunghunney Nation. I am the CEO of Nunya Jarjum, which is an out-of-home care and family prayers service that's located on Bundjalung. So when I say I'm from Dunghunney Nation, that's Kempsey, New South Wales. Bundjalung is the northern in Lismore, so I work off-country. I have worked for 36 years in the human services across the board, and that I've worked for with Centrelink, I've worked with CES, if people can remember that far back, what CES actually stood for. And that's really going way back. I've actually then worked for DOCS for a number of preferably 10 years, but not as a child protection worker. I actually worked in the contract commissioning and planning side of the aspect of DOCS. And then I came over and worked with an ACO, and I haven't turned back since then. That is over 15 years ago. So have been actually in this kind of human services field for some time. And just to do that human justice and that for our kids, like our people, our community, that's what my passion is for.
Thanks, Ursula. Lucky to have you here today. Now, Timothy Noakes, I haven't ever worked with Timothy, but I've been fortunate enough to have a few conversations with him recently. Timothy, can you just tell us a little bit about yourself?
Hi, my name is Timothy Noakes. I am a young Aboriginal man from the Northern Territory. I live on the Larrakia land. I am a young consultant for Create and a young advocate for the youth in foster care. So I do a bit of work with them. I've only been doing it for about 2 years, but I've pushed for a lot of change. And we've been seeing a lot of results. So, yeah.
Thanks, Timothy. I'm really looking forward to having you as part of the conversation. And last but not least, Dr. Melissa Kaltner from Lumenia. Why Melissa and I haven't actually worked together, we've seemed to have been in the same places at the same time, and really excited to have you and hear a little bit about your research. Can you just tell us a little bit, Melissa?
Absolutely, and thanks so much for having me, and how humbling to be surrounded by such amazing panelists. I'm really looking forward to the conversation too. I too would like to acknowledge country. I'm dialing in from lands of the Gadigal people of the Eora Nation, and I'd also like to acknowledge the leadership that Aboriginal and Torres Strait Islander peoples play across our sector. I grew up in Gubbi Gubbi country, which is on the Sunshine Coast. I now reside in Gadigal. I started my career in frontline child protection practice about 20 years ago in Queensland, and I've led research and evaluation teams in child protection and out-of-home care sector since that point. I completed my PhD in the child protection space and was really privileged to undertake a Churchill Fellowship as well, looking at out-of-home care. 18 months ago, I co-founded Lumenia, which is a child and family-focused practice. We have a team across Australia, and we have the privilege of working alongside peak bodies, providers, ACOs, and partners in academia as well to support the development of child protection policy, service design, and impact measurement. And I'm really excited to be part of today's conversation.
Thanks, Melissa, and welcome to all the panelists. I don't know if everyone had the opportunity to see the quote that was on the screen when you were coming into the webinar series. I'm going to read it to you because I think it really grounds us in what we want to have discussions about today. It was a quote from Alex, who's 28 years old, and he worked as a child protection caseworker for 2 years, and he is now a police officer and has been for 3 years. He said, reflecting back, being a caseworker was the most rewarding job. I was 22 years old, as were most of the caseworkers, and we had the most insane responsibility. I'm still astounded by the decisions that we had to make, and while it was great to be afforded such a responsibility, I don't think that the general public have an understanding of what it's like, and they really should. The general public have an understanding of police, nurses, etc., but as a caseworker, you have no backup, no communication means, no body cameras. You're on your own to get yourself out of difficult situations. It's a testament to caseworkers that they do get themselves out of these situations. And I think this is because they are good communicators and good at managing difficult situations. It really is a testament to the individuals. I have never worked as hard in any other role or had the level of responsibility or the level of paperwork. It's unprecedented. It's insane. And I think that that really does capture definitely my experience in frontline child protection. So with that quote in mind, we're going to start talking about the daily reality for workers, children, young people and their families in the system. No doubt that all of the panelists will bring a different perspective to the conversation. So Jeanette, we might just start with you. In your experience, how do political narratives, public expectations, or media portrayals shape the way that you have been able to do your job? I'm going to have to get you to unmute. We did practice, everyone.
I know, I had to be the first one to do that. Look, I've just got to start by saying, rather than just talking about me and my job, I absolutely love that quote. It resonates 100% with my experience. And look, just a little anecdote. When I went to Territory Families from policing, we were having a discussion not long after COVID and the lockdown, and which was particularly challenging for frontline child protection workers and their managers as much as it was for anyone else. But we were still delivering service on community, and in remote community, and staff, were remained on community. They don't leave the field, child protection practitioners, unlike other professionals. I've got to say they're always there, and they're there long hours. And we were in an executive meeting, and a senior manager, someone commented how police were going to have COVID medals struck for themselves. And the senior manager said, crikey. Well, it wasn't actually crikey. They go out with a gun, a taser, pepper spray, and we go out with a notebook, a pen, and they're going, I don't see medals for child protection workers. And you know what? If not medals, there should be some much higher level of recognition. And I think as agencies, we don't do enough to promote the good work and the positive image of care and protection workers. So that's an absolutely essential point for me as a leader. It's almost like child protection doesn't want to have any media. The only positive stories they put out are when you're doing recruitment campaigns. And, they don't want to put out the really positive stories in case something's going to go wrong. So, that's something I think that as a profession needs to be promoted nationally and internationally. In terms of political narratives and media portrayals and how that impacts executives in general, in particular in care and protection, often working to ministers, new ministers, ministers that don't understand the context, or with a government that's tough on crime. And tough on crime also relates to tough on children, tough on families, particularly tough on Aboriginal families and the most vulnerable. So there's a focus that these issues of youth crime and children and families become a primary focus of these types of governments and inexperienced ministers. And what that then means is there becomes a pitchfork mentality, and that gets exacerbated in the media. It's they focus, and it allows what it does, it enables the community to focus less on the important issues and then more on this crime narrative. It's a total scapegoat. So, and then they manage to wrap in economic outcomes and education with this whole narrative. And it's exacerbated, in my mind, by, social and digital media over the last decade or so. News is rapid and real time. Anyone can be a commentator, anyone can be a journalist, so to speak, and the sensationalized is what people read and then comment on, and then there becomes a perception that those that comment on social media, often with really disgusting, inappropriate comments, are the community. So what that does is then drive the narrative and pervades, it can, if without strong, experienced, genuine leadership, can pervade across agencies, and soon there becomes a blame culture. Soon there becomes a we'll keep our head down. And instead of agencies and non-government agencies collaborating and working together in a multi-agency context with children and community safety strategies, what you end up getting is, what are child protection doing? Every time something happens, it gets to the media very, very quickly now. And what are child protection doing? It's child protection's fault. We've reported this so many times, when in fact what the reality and the truth and the facts rarely come out, and child protection agencies rarely come out, and youth justice agencies come out and correct the narrative. And I think they need to do that in their ministers much, much more strongly. And you end up with a context in the community and within the agencies is, children aren't going to school, non-attendance, oh, that's a child protection issue. Or there's volatile substance abuse and particular cases, particularly in the territory, oh, that's a child protection issue, not a health issue. Or there's youth crime, that's a child protection issue, that's not a policing or whole of community issue. And this sort of blame mentality and the shrinking of working together is, the outcome of these media sensual, you know what I mean, media focus, the community focus, political narratives. So as a leader, you need to really, I think, differently and outside the square. You need to promote your staff. You need to promote the work, and have a very clear, strong vision and culture that you drive within your agency. And you need to, as my old CEO used to say, stick to the knitting. You've got to be really, and it's very challenging for some senior executives to be able to stick to the knitting, so to speak, when you have ministers that want to see heads roll. When someone leaves, when a young person leaves detention and they're not supposed to jump over the fence or try to jump over the fence, next minute they want to see heads roll. And a lot of people get very scared about that. So it's you've got to have strong mettle, and you've got to really stick to your values, your ethics, and your vision as a leader, I think.
Thanks, Jeanette. I listening to all of that, I'm thinking, who would want one of these leadership roles? It's really complex, and I think that we do see nationally that there is a blame game, and we don't highlight as a sector the amazing work and the complexities of the work. And I agree that quote from Alex just really sums it all up. Thank you for your insight, and we'll loop back to Jeanette and speak a little bit more about that and some of her strategies on how she managed that, those complexities, a little bit later in the webinar. But we might just move on to you, Ursula. I'd like to just hear what some of your observations of the realities are for frontline workers in child protection, and any specific considerations for our Aboriginal and Torres Strait Islander colleagues.
Thanks, Lisa. First of all, I just want to actually acknowledge and pay my respects and that to the elders past and present and those who are joining on today. That was very disrespectful of me when I introduced myself before. I should have done that because I'm actually speaking from Dharawal land on the Eora Nation in Sydney. So I just want to get that out of the way so I know that I've done that right. So the question that to answer for you, Lisa, in regards to that one, is I find in the fields that I obviously work, and I do manage an out-of-home care service, I do find that there's a lot of new social workers in that fresh out of university. Their textbooks, can I just say, everything in that is case study textbooks kind of scenarios. And so I think that the social workers in that come with that in mind when they go and do field work, especially in the areas in that out-of-home care. When they're actually doing the field work and they walk into these houses, and yes, we don't have a gun, we don't have any badges and that, we do have the paper and the pen, I think, like Jeanette was actually sort of saying, and that's all you got. That's all you have in that when you go out in this field. The things in that you actually then are faced with when you go to these house visits or home visits, and that you then see reality. You actually see how people live. You actually see the abuse that the children and the neglect and that they have and endure every day. You actually then sort of kind of, it's like that shock kind of effect in that they have, because this is the first time you're seeing it in reality through your eyes. This is how sometimes in that families do live per day. And children and that do struggle in that within this kind of environment every day. So not only will you maybe see like children that are not being fed, you'll see children that aren't even being clothed or washed. There are so many of the elements, and that children even sleeping on the floor. Like, I know that that's not a novel thing, but it is in Aboriginal community. Like pulling a mattress out and sleeping on the floor, that's kind of all right, but it could be actually considered as a child protection issue. That's where our values in that change. And there's a lot of other things in that you will be plagued with in regards to like sexual abuse. I know we're touching on maybe, that's things in that you maybe come witnessed in that too. You maybe also come across limited education. Now I'm talking about with parents, not only with the children or young people. You've got to adjust yourself in that because, again, you're a very educated person coming into this household, and all you're doing and wanting to do is your bureaucratic kind of processes. You need to adapt a little bit and be relaxed and flexible, especially with my people, or our people, I should say, and just really just understanding that their lifestyle, their environment, and also where they've actually come from may help you in regards to work through or work with this particular family. I want to touch on Alex's quote too, because I know that he's it was a lot of paperwork. It was such a lot of work in that they actually had to do as a caseworker. One of the things in that I think I spoke about before, and I know when we were doing our pre-run, was about caseworkers, regardless of whether you're white, black, brindle, whichever the colour you may be. You have police officers in that are subjected in that to daily trauma. You have nurses in that are actually also subjected to daily trauma. Caseworkers are also trauma, and this is where I feel like that PTSD is not ever, there's no light shine on that for them. So we have to obviously manage it ourselves, or they have to manage it themselves and work through it, because again, there's nothing in place. Like, it's sort of like, yeah, you know, yeah, I've seen and witnessed all that in one day, but now I have to actually get up the next day and, resume work as per normal. We don't have that kind of, and we should be supporting our staff in that safe space. And I think I'll be talking about a little bit about cultural safety in that later in the webinar. But I think we need to be mindful of that and take care of our caseworkers in this field. This is such a hard field. It's like it's so many diversities in that within this field. You just don't know until you're exposed to it. And I just want to make sure that we all sort of take care. As an Aboriginal person, we kind of live it 24/7. We live and we operate in our communities, and that sometimes, I know it's really hard, I suppose, for the other people in that to understand that, but it's because we are so connected in that with our community, we can't sometimes shut off as much as we'd love to, because we actually run into the same people in the shopping centre. We can't kind of just turn away, because then that's disrespecting them. We have that level of respect in that, no matter whether we're workers, whether we're a community person, and it's really hard again to say shut off that professional to personal. So I just think in that, like, you need to be also mindful of that kind of aspect, in that when you have either a Aboriginal person working for you, or you are, and like you're the manager. I think we're talking about, Janet talked about leaders before. If you're also got a manager and then you're trying to enforce this and that to a caseworker, be respectful and be mindful that that person could be a leader in their own community, not so much as a leader in the service. I hope that makes sense in that to people. And just be also mindful in that Aboriginal is, if you have an Aboriginal staff person, regardless of whether they're from that community and or from another community, in that, just be mindful that not every Aboriginal person or First Nation person, I should be reflecting, actually understands in that our culture, because they could also be on their journey. So you've got to be mindful of that also. So again, there's a lot of, like, look, factors and that to be taken on board, and that when you're either dealing with an Aboriginal community or have an Aboriginal worker. That's all I can kind of.
That was a lot. Thank you, Ursula. I think that it really highlights that there's a lot for a 22-year-old straight out of university
Yeah.
to actually learn and get their head around. And I think that those complexities, and correct me if I'm wrong, but working in smaller regional and remote communities, they're actually amplified for those workers often, and especially those First Nations workers. So, I think if you put that in the context of, a lot of workers are 22 years old, and they have got to get their head around all of those complexities. So, Melissa, we might now come over to you, and I'd really like to hear a little bit about what is the evidence actually telling us about the state of the workforce, like stability nationally.
Thanks so much, Lisa. And I think it's to start, I just wanted to acknowledge all of the complexity that sits around this work. And, Ursula, to your points around exposure to trauma, colonial load that sits for our Aboriginal and Torres Strait Islander workers alongside that cultural centering that's really necessary for the workforce. And the level of experience that many of us, including myself, and I'm sure many of us on the line today, had when we first stepped into our roles, and how that's really misaligned with some of the level of complexity that's required for this work. There's no publicly available data, is the short answer, on national workforce trends within the child and family sector. When we look at jurisdictional data, New South Wales is the only jurisdiction that reports in a routine way on caseworker vacancy. Their vacancy rate is currently sitting at 7% as of March 2025, which is down from a high of 12% last year. However, of course, rates vary across districts, and so there will be some areas, particularly regional and rural areas, that will have much higher vacancy than others. As I mentioned, most other jurisdictions don't publicly report vacancy. However, we can see in media reports, and Jeanette, you made that point really well around that sensationalism in media, but we can see within media reports where they have focused on the child and family and child protection workforce that there are similar rates of vacancy elsewhere. So, for instance, in my hometown of Sunshine Coast, it was reported in 2023 that there was 11.5% vacancy of the child safety officers within that office. And there have been a range of commissions and inquiries, reviews, union reports that continue to cite that persistent high turnover within the workforce. It's been suggested that up to 50% of new caseworkers leave within the first 2 years, and that's attributed to things that we've discussed today. So some of that stress and burnout, those caseloads, pay pressures, and not feeling supported and recognised in that work. When we think about the impact of workforce vacancy on the way that we deliver our services across the sector, in New South Wales, only about 23% of children who are reported at risk of significant harm are actually being seen by caseworkers at the moment, and many families receive no meaningful support until they hit that crisis point. So in reflecting on the consistent challenges that we have in attracting and retaining the child protection workforce, and I think it's worth saying too that these are really persistent and long-standing challenges, and I'm sure for all of us who've been around this sector for decades, we've seen this continued focus on workforce in the absence of really solving these issues. I'd like to suggest, alongside the suggestions of our great panellists, that it might be time for us to think a bit differently, and for the child and family sectors to rebalance some of our investment in earlier supports and services for families, as I believe that in doing so we can address many of these workforce challenges. And I base this on the evidence that we see both from Australia and internationally that speaks to the fact that earlier and relationship-based support for families is firstly more likely to keep families together and keep children safe, but also better matches the aspirations of the child protection workforce. So we know that for most, if not all, child protection workers, they enter the field really wanting to empower families, wanting to work in collaboration with families to create change. Yet there are practical realities which we've spoken about today in the practice, those resourcing pressures, the emphasis on statutory crisis intervention and response rather than earlier support, which lead to what the literature calls moral distress in caseworkers. And it's suggested in the literature and evidence internationally that this contributes to those eroding well-being of caseworkers and drives that turnover that we see. So I'd ask everyone for a moment to consider what the sector could look like if we were to significantly shift our investment into earlier supports and working more collaboratively with families to reduce the downstream pressure on the child protection workforce and that crisis response demand. And of course, there'll always be a need for child protection statutory response. And Ursula was speaking beautifully about some of that complexity that sits around families and the challenges that they're navigating. However, we know that in this reimagining process, if we were to think differently about the workforce and invest differently and rebalance some of that investment, we would see that we would have a workforce where their roles are more aligned to their aspirations and what attracted them to the field to begin with. I would suggest that this revisioning process would also allow us to have more specialisation so that we could really recognise the skilled and the unique contributions that the child protection workforce brings to support families at that crisis end. But we really do have the opportunity to reconsider both what our workforce looks like and its makeup as well. Thinking about things like investing in a more diverse workforce, to some of the points around the great work that ACOs do across this space, Aboriginal and Torres Strait Islander community-controlled organisations, and likewise peer and lived experience roles. There's a fantastic evidence base that shows that when you have lived experience workers working alongside families, you see increased engagement and you see stronger outcomes for children and young people. And we know from Lumania's own research that addressing vacancy won't necessarily change practice outcomes for families. So, for instance, in New South Wales, when we look at the evidence base, we see that workforce vacancy is actually really closely associated with numbers of children being brought into care. So when there's higher vacancy, there's lower numbers of children being brought into care. And when you look at the proportions of children who are being seen versus those who are entering care, that actually hasn't meaningfully changed. So if we build the child protection workforce with more child protection workers, in the absence of rebalancing our investments and in the absence of different practice supports for our workforce, it's likely that we'll see more of the same challenges, in my view, and I know we've seen this over decades. So I'd encourage us to think differently, not just about our workforce and how we recognise and support our workforce, but also about the child and family service landscape more broadly, as I believe that these are inherently linked areas and they really hold the key to addressing workforce challenges and empowering families.
Wow, thanks, Melissa. That was a lot of information that I just saw all the nodding on the panel saying, yeah, we definitely need to look at that shift in investment to early intervention and prevention. And I know that the panelists understand the importance of that. But I think it's a pretty stark thing that we say 50% of caseworkers leave within the first 2 years, especially when we've heard Jeanette and Ursula talk about the complexity of these roles. Like, I know for myself as a caseworker at 23, I don't feel like I could even go and knock on a door without my heart beating in my throat for about 5 years, knowing what I needed to actually do and say. So, like getting a workforce that has been around longer than 2 years is actually really, really critical. And so we'll talk a little bit more about that after. But Tim, I just you've heard the panelists speaking, and I just wonder how that translated for you. We've heard that the workforce is really they're quite young, they're straight out of uni, there's a lot of complexities, there's a lot of staff turnovers, and there's a lot of vacancies. So what were the realities for you as a young person in care, and what were your relationships like with your caseworkers?
Yeah, I guess touching on that, I guess what my relationships with the caseworkers looked like was, I guess, how do I put it? I mean, I got to know them to an extent, but it was just a bit weird because I had to like always get to know like a new caseworker because I think I had like a couple, and I guess it wasn't enough time to properly like trust them. In case I needed things, I wasn't able to like speak up. I'd always like, tell my carer like if I needed anything, and she would go tell it to the caseworker. And I guess like I've always, wanted to have that trust and relationship where I could do it myself and stuff like that. Yeah, because I guess I was just changing caseworkers too much. So yeah.
And that's really hard, isn't it? Because you need to build a relationship and you're wanting to talk about really important things, but if you've got a different caseworker all the time, that makes it really hard. So can I ask how many caseworkers you think that you might have met throughout your time in care?
Uh, Probably about maybe four-ish, five. There was only one that I know of that I had like before I transitioned out of foster care, and it kind of carried on maybe like a year after or two, when I moved to Tassie and turned 18. Um, it was a bit rocky because we never really got to see like face to face. It was always over the phone for like, certain meetings and stuff. So it just made it a little bit complicated. But that was probably the one that I've known the longest. So I had an actual relationship where I was comfortable enough to tell her things. But yeah, I guess probably about like four-ish, five. Yeah.
Yeah. When we were talking last week, I just said, hey, did any of them remember your birthday? Tell
A
me.
few of them, yeah. But I guess like I think maybe two of them I think didn't really come in because they were just had too much on their workload, so they just pretty much sent like a postcard in the thing saying happy birthday. Uh, Jesus. Bird. And yeah, I just not really had that like feeling that like it meant as much as they probably were thinking it meant. Something like that. Yeah.
Yeah, thanks, Tim. And I guess that's what we see translating. We see those vacancies and that high turnover translate into the service that we provide for those young people in care. And we know that those young people in care need relationships to build trust more than anything. And it's really hard to do that
Yeah.
when you've got changing caseworkers. So thanks, Timothy. Look, we've heard a little bit about the issue about worker retention. So with that question in mind, I'd like to explore what needs to change. And I might just start with you, Jeanette. How do we as a sector ensure that the lessons we learn remain in place, especially across political cycles? And I think that that's really important discussion to have because we've seen a lot of government change in states and territories in the last few years. So how can we retain some of the good work and the learnings that we've done in that sector?
Yeah, thanks, Lisa. This is, look, absolutely critical that should be uppermost in the mind of executives and CEOs of agencies because I went into the agency as the deputy in Territory Families when there was a change of government, and at the same time the Royal Commission had been announced. So, we had a number of options in that space. One was, oh, let's just wait for the outcome of the Royal Commission and just plod along. Or let's just get on with the change that we know is needed. We need to have a completely different executive structure and way of thinking because, basically reforming child protection really shouldn't be that difficult. It's because all of us really, I think, collectively know what should happen and what's the right thing to do. So in terms of from day one, we were absolutely aware that the change that we were making had to be sustainable. So you need to really focus on the mechanisms for sustainability. And for me, there's a number of big ones that are essential. And one is to your people and your culture in your organisation is paramount. Probably the hardest one to do, but the most important. And to achieve that, you've got to have a very, very strong vision. And you can have the vision for the agency. Unfortunately, we became a big agency, or fortunately as well, we had housing, a whole range of things in one. But for care and protection, the vision was within 5 years we were going to be the best child protection agency in Australia, if not the world. I would say that to my staff in the Northern Territory who, see themselves that not as, as sophisticated or as impressive as other jurisdictions, which is rubbish, but they're always feeling like they're doing the worst. And they were like, what is she on? Like, seriously? And they have a bit of a snigger. we got to the point over about 4 or 5 years where Eileen Munro came out and did some work with us, and I said, this is what we want to do. What do you think of us before you came? She goes, oh, you're the worst. I've seen the media of all the stuff about the Royal Commission and what's happened here and there. You're the worst. I thought you were the worst, and it couldn't get much worse. And I said, well, now that you've been here a week with us, what do you think? She goes, I said, because our vision is to be the best in the world. And she goes, well, I think the best in the world is Scotland. And at that point, and she goes, but you're not far off. But that was a really sustained, focused initiative. So it's about the culture. So you've got to absolutely invest in your staff and your people, particularly your Aboriginal staff. You should be able to join the agency as a community support worker or Aboriginal community worker, and we should have a pathway for you to end up as the Deputy CE or CE over time. And we have a number of people that have achieved that. So we should be investing in growing our own local workforce. Where the other things, and I'll really wrap this up quickly, is the leadership is important, and leadership needs to be stable across all aspects of the agency as much as you can. And good leadership needs to be, and good work needs to be celebrated constantly, and good achievements. So, as an agency, you have to have a yearly People Matters or staff survey, a really comprehensive one, so that you can pinpoint where you're not doing well and focus on that, but also celebrate those aspects of the workforce that are awesome. And there are pockets of awesomeness across the workforce. So I think also in terms of your systems and your policy, we were fortunate enough to invest in an IT system or a case management system that could encompass and invite in, NGOs and have 360-degree view of a child. And when we built that, we built in our practice framework. And we researched what we thought was the best practice framework internationally, which is Signs of Safeties. It was in 40 countries, 200 jurisdictions. We really had a look at that compared to what was happening around Australia. And in a number of jurisdictions have Signs of Safeties, but I can pretty confidently say all other jurisdictions have something that looks very much like Signs of Safety that they use in any event, So, and then, other things like Safe and Together and DV integrated practice. We didn't just adopt them and say, okay, we're going to train you all in this and go out and do this practice. We built it into the case management system. It was integrated across all policy. The PD related to it went from the CE down, including our finance staff and our HR staff. So it was a whole of system focus that we invested in. And it wasn't like, okay, we're going to do this and 12 months later we've done it. It was over 5 years and continuing. We also did that work with all of our NGO partners, our ACO partners. We set up communities of practice. So all of those things, it's about embedding the culture, embed the practice, embed it in the system, and also change the legislation as best you can to match it as well. So all those things need to line up. So obviously in change of government, and the Northern Territory is experiencing this at the moment, there can be a real thrust to undo some of that work over time. But it's very, very hard to change an IT system. When the practice model's built in, it's very hard to change a practice model. Legislation change usually takes some time, but is less meaningful if your systems, your practice, your culture and your policy don't align with it. So for us, we're very conscious that all of these things had to be aligned, and key within all of that was having an Aboriginal practice leadership group and changing the culture from being led by strategy and policy to being led by frontline practitioners. So policy was led by frontline practitioners, not by necessarily a strategic area that might be responding to ministerial direction because they want to count a widget here with no regard that that impacts the frontline by adding an hour of paperwork when they build it in. So that flip, I think, is really essential. And then over time, that culture with your staff needs to be very strongly based on trust. And I'm probably going over time, but I'll give you a very quick and very simple anecdote. You work into a child protection office and usually none of the chairs match. The office furniture is, broken down and rubbish. There's 5 old, mobile phones over there that you can book out to go on a visit with your notebook. And that says to your staff, we don't care about you. So for me, it's about the physical environment's really important. They've got to have a decent, nice looking, comfortable workplace. We gave all of our staff an iPhone and a tablet, so you could do work in the field, you can have your phone, and you didn't have to book it out, it was yours. And that is not a big investment in your staff. But when we first suggested that, it was actually the CP managers and executives says, oh, we can't do that. And we're like, why not? Well, they need to leave them at work at 4 o'clock. Why not? These are tertiary educated, committed, intelligent people. Give them the tools to do the job the way they want to do the job. And then you get the old, well, they can't have access to the internet or they can't download apps. Why not? Like, give them one phone. Use it for whatever you want. It's a simple message that says, we trust you, and you need to roll that through everything you do with your staff. So anyway, I think they're the key issues. It's around people, systems, policy and practice all needs to be aligned and embedded with legislation as best you can. And then it has a chance to survive over 1 or 2 cycles of media political change.
Thank you. And I think the story is worth going over time for, but I still have some apprehensions around leadership and culture surviving if you don't have the right leader coming in after someone who's had all of those initiatives. And I appreciate all of those things that you've done and, all of the long-term thinking around that, but I think governments still need to make sure that they get the leadership and the culture right in that leadership.
I completely agree with you on that. Some governments don't want to have the right leadership. Yeah. I mean, I think we're naive to believe that a government comes in and has the same vision, and so what you need to do is build something as strong as you can, knowing that there'll be maintenance needed in the future and there'll be erosion. But ideally, governments do come in and not do a captive stick and not put in people aligned, but rather people who experienced, qualified senior leaders. And that child protection is not seen as a lesser ministry or a lesser department than others.
Absolutely. We're in agreement there. Ursula, I'm going to now just keep moving along. I could have that conversation for a long time, Jeanette. Can you just tell me, Ursula, how can leaders and communities ensure that workforce practices are culturally safe and responsive, especially in under-resourced areas? And I think you touched on that earlier, but if you could just explore that a little bit more.
So I'm just going to sort of speak in regards to my service that I obviously provide. Again, out of home care and the family pres sort of intervention models that I do have. I think the focus on this was around retention and that of workers. 1, to recruit workers, 2, retain workers. I believe that we all would love to have skilled workers and start afresh from there. That would be wonderful. Sometimes that's just not the case in our areas because we are so under-resourced in regards to skilled workers. And this is a thing in that throughout New South Wales. It's not just with my services, it's just with any ACCO services. When I say ACCO, that's the Aboriginal Controlled Community Organisations. For me, I generally put culture first, and that when I say put culture first, that means that I want to employ my people first, so my First Nations people. So I actually ensure that the ad that we do is really culturally appropriate, and it obviously ensures that that person comes in with skills. Now, the skills in that match our workplace and our workforce. So that's one of the things in that we actually have done and spend a lot of time in with HR and that to ensure that we do that, because apart from getting skilled people, I also want to encourage our community people to actually apply for these particular positions too. They come with life skills They may not come with PhDs, they may not come with degrees or bachelors and everything like that. They actually come with life skills. They may have lived this within their communities or their family or somebody they know have lived the same experience in that they're coming in with. And I believe like Department of Communities, that's an old thing. Department of Community and Justice, DCJ, they actually also mimic that. Like they actually have staff that comes in with life skills. So I really enforce that in my service, and that because again, apart from we get the skilled people in that've got some kind of accreditation in regards to certificates, so forth, I also offer a low entry level. So if there is a person that I feel like they've gone for a position and they may have not been unsuccessful for that particular position, there may be something within my organisation that they could fit and we could build their skills and that to become a person, like a worker in a particular area. I'll give you an example. There was a person that was a scaffolder. Now, a scaffolder has no idea about this sector or like a labourer and has no idea in regards to what child protection is. So to come into this kind of sector and even apply, I gave him credit for that because this is something he wanted to explore. He wanted to give back to his community. As I said, he was unsuccessful in that to get a caseworker's position, but I actually thought there was a position as a casework support person. So if we gave him a ground level entry into our organisation, then therefore he would be exposed to what type of work and that he would actually be wanting or getting involved in. It gave him an insight in that to what skills and that he may need. And he is now like a year in, he is now wanting to become a caseworker. So because he can see the difference in that, and he really wants to be involved with these kids' lives, and he wants to be that pseudo uncle, that we become. Sorry, Timothy, that you hadn't had that experience, but this is like again, with in being an ACO, we have that kind of, I suppose, luxury in that of becoming that aunt or uncle. And I don't want to minimise people's skills, and that because everybody comes to our organisation or to any organisation and that with some level of skills, whether it be community, whether it'll be actually like educated and that or not, still recognise all of that and build on their skills if need be. Again, you have such, if they're interested in this area or whatever area you may be listening from, if they're interested in this particular child protection area, again, if you have them coming through your door, like keep them. This is where the retention starts building straight from there. Because if they show that interest, I believe then you kind of think, well, come in, nurture them, build their skills, train them, get them involved in this particular area. Another area that I think is a really good avenue in that for young people to come in is through traineeships. Like they're gone by the wayside I have not heard a lot of people utilising this space in that before. I know they do cadetships or, and get them through there, but traineeships are also another area, and that for young people that wish to actually come in and learn this sector. So these are some of the things in that I do within my service. We also try and do a meet and greet days. To ensure that people, if this is a space they want to work in, well, come and listen, come and hear, come and actually see our building. So that way then you have a sort of an inkling in that of what this world looks like, because nobody knows what this looks like until you're in it. Nobody knows about the out-of-home care sector because it's not advertised as such. And it's not advertised as let's come on board. Here, come and have a look at this. This is what we can do and offer. No, it's not a job, and that people think it's all rosy and rainbows and sunshines. It's actually not, but it is a rewarding position, and I do, as I said, do my damn best in that to keep my staff. And when I say my staff, I do employ a lot of Aboriginal and First Nations people, but I also employ non-Aboriginal people in specialist services or in the allied help, because we also, especially in my field, I actually need that. And if I had an Aboriginal person that was out there that had those quals, they'd be no sooner beaten the tap on the shoulder and asking to come over to work for us. The reason why I also wanting I get my First Nation people and that to come in, because there's already that bond and that kind of connection and that with my people or our people, and we're the only ones who can actually have that conversation about culture. It's really hard and difficult for a non-Aboriginal person and that to be having those conversations or enforcing culture when they have had no idea or experience in that. So that's hence the reason why, I do that for us in my area. Yeah.
Thanks, Urs. I think that hearing from you and Jeanette, it's clear about that both of you are leaders to aspire, for us all to aspire to. With regard to the scaffolding, I guess that he at least would know the need for foundational support, and so that might be quite useful. And I think that one of the things that we really need to take from that is that life skills are actually really, really important and can be crucial, and for us to maybe think a little bit differently about how we are employing some of our workers. I'm going to go now to Timothy. And Timothy, some of the questions that are coming through the chat, that people are, I also think that you're an emerging leader in the sector and already starting to do some great things up there in the Northern Territory. And people would like to just hear a little bit about some of the things that you've been able to do in your platform in Create.
Yeah, well, some of the achievements and I guess the things that I was able to do was I was able to attend the 2024 I think it was like hang
Was
on,
it a
so I forgot what it was
symposium?
called.
Yeah.
It was held in Adelaide. It was like a Create conference for kids in care and stuff. And it was pretty good. We heard a lot of like really cool and interesting stories. We heard from, I guess, like a lot of the people that work in that sector as well, on like things that like you guys have touched on as well already. And it was pretty cool and I guess an enlightening experience because I've never been to one of them before. And I guess that kind of drove me a little bit more and like sparked my passion even more to make change, see change, and just see the final results. As well as like I've attended a few of the roundtables with a few of the people like the children's commissioner and stuff. Not children's commissioner, but people that work with her. Also people who work like within like the territory families and stuff like that. So I was able to share a few ideas, give them a little bit of like tips and insight on like other subjects. And I've been doing like meetings with, I think it's the children's commissioner or the minister, and just giving her an idea of what the Create Foundation does for like the young kids in care, and for the people who are like emerging out of care or have left care to better ensure support and support afterwards as well, so they're like not really left hanging. Because I do see a lot of them, some of the support disappears, so we're trying to keep that support ongoing. And just letting young people know that their voice matters, and anything that comes up within their life that like affects them as a kid in care and other stuff like that, it helps them, I guess, find what they want to say and what they want to see change, I guess. And so yeah, I've been able to help with that and push for better, I guess. Yeah.
Thanks, Tim. I think they're lucky to have you up there.
Thank you.
So I
I'm
think
lucky
we
to have
watch.
them.
I think we watch this space, right, and we'll see great
Mhm.
things coming from Tim. Melissa, can you just tell me a little bit about the latest research and how we can use this evidence to guide some meaningful improvements?
I think, thanks for that, Lisa. And I think actually in the stories that we've just heard and some of the really powerful work that Tim, you and all of your peers are doing in advocating for systems change and in supporting other young people with lived experience, that's testament to the power of lived experience voices in this sector. And Ursula, what you were talking about in terms of bringing in people from adjacent sectors, thinking differently about what the workforce looks like, and recognising that that lived experience and that cultural expertise is its own form of expertise and needs to be recognised and appropriately remunerated as well as a component of that. But thinking about those opportunities to really build the workforce on the basis of that diversification. And when we look at the literature, we know whilst pay is a factor to a small degree in what makes people feel satisfied in their jobs, and some jurisdictions we should mention too in this conversation have recently announced commitments to increase pay and conditions for child protection workers. It's not the determining factor. And Jeanette, some of what you were talking about around providing those supports, providing safe spaces for your teams and acknowledging their contributions, and really importantly enabling leadership pathways for diverse people, including parent advocates, lived experience, young people. When we think about those diversity pathways, ensuring that there are Aboriginal and Torres Strait Islander leaders across our organisations, all of that helps to shift the workforce in a meaningful way to really address some of those challenges that we've spoken about already, Lisa.
It was nearly me. Almost. Look, they were really interesting conversations, and I can see that we're going to run out of time, so I might just throw to each of the panelists and say, what is it that we should turn our future attention to? How can we strengthen this sector and support the work that the people do? And also give us one action that you would like the people who are tuning in today to take away from you. I'll start with you, Jeanette. Just tell us a little bit about what innovation looks like. And you talked before about technology, community-led, policy-driven. There was a lot in there, but what does the sector truly need to do to thrive?
Okay, so I think in terms of thriving, and we've talked about a lot of it, a technical aspect would be a national system or a system that integrates our systems. That would be a massive leap forward. And agencies stop being competitive in, like, we're just as bad as within our jurisdictions, agencies blaming each other. We're almost as bad in some ways across between our jurisdictions. So I think a cohesive forum across the jurisdictions, not at the ministerial level and people that, but we need to have forums for executives, practice leaders, communities of practice, and have a national identity or a national peak almost that can advocate for a shared system. And I include ACOs and community-based organisations in that. We shouldn't be seeing ourselves. And I want to say what Ursula said was the luxury she has to bring in people with amazing skills. It's not actually just a luxury for ACOs and NGOs. Government can do that. If the government agencies, our agencies do that, the mechanisms are there. We just need to start having more trust and wanting to grow our own, because it's hard work. So there's that. I've talked it. Well-being has to be at the.
I don't know. We can still hear you, Jeanette. We can't see you.
In terms of information sharing across the community sector as well as technically between. We've got to stop being very silly about our information sharing, because the community thinks we do it anyway, and it's the only way that we can do really good joined up service delivery. And I think just finally my action would be to challenge everyone listening, whether they're executive or frontline workers, to try and work in a collaborative cross-agency way, internally and externally, and don't make decisions for families, particularly Aboriginal families and children, without getting the support and knowledge from your Aboriginal practice leaders or your Aboriginal community workers. Thank you. Thanks for the
Thanks.
opportunity.
Thanks, Jeanette. I don't know where you went. I don't know. I can't see you on my screen. I don't know if others can see. We can hear you, but we can't see you. Ah, there you are. You're back. Magic. Look, thank you for that. I think there's a lot to take from that about being cohesive, not just within our own states and territories, but across nationally. Like I think that is not just in the child protection system, but in the not-for-profit as well. I think that's a really great action that we all might be able to reflect on throughout National Child Protection Week. Ursula, I'm going to now throw to you. Like we're saying, the workforce, you've been talking a lot about the well-being of our workforce, it being critical. What are some of the things that you think that we can do to create those environments to have, and you talked a little bit about hiring, life skills, but how do we generally support our workers to work in the best way possible with children and their families? And what's your action?
All right. So in my area, again, I can only speak for my area, but I really try and think of it being a blanket, and I hope people take this on board in your own services and organisations, and that to work and that with our communities, children, families, and that I've also want to make sure that we're building the skills and that internally and that of the staff to do this. So I also, for the morale, to retain, to ensure that they've got culture, because again, you may have people in that's not from that area, so you've got to be mindful of the cultural protocols and that within that area. So one of the things, or a couple of things in that I'll like to touch on and let you know what I do internally first. So I support my staff in that by doing 2 wellbeing days. Now that's a social and a cultural day, so that's like 2 within the year and obviously to keep that morale, just the camaraderie in that. So again, so everybody knows who's who in the zoo in my organisation, because you can have those splits. Departments or services and that, or program areas where people won't even know who they are. Even though we work in the one service, you don't actually have that connection. So that's one thing. I'd like my staff to be connected so they can then be connected to their community and also the children that we work with. We also hold yarning circles, and I don't know if this is something in that the other agencies in that do, to encourage staff and that to go and freely speak, not to the leaders, but amongst themselves, and that if they've got issues, and somebody then from that particular group will bring it and bring it to our execs meeting, because that's then their support, like a union rep within their team, but it's not that within that group. Sorry, it's not so much as a union rep. I offer breakout spaces because I think that's crucial, especially in that for the work that we actually do on a day-to-day basis, to give them that space and that to do that. We offer cook-ups, flexible working time hours, and that to accommodate if we've got working mums or parents and that, so that way then they can actually come in at a different certain time. I still enforce the working from home, allow 2 days in that per week, again, if there's things in that's happening in the home life, because again, you have to have this work-life balance to support staff, I believe. I don't think we need to be so cut off and bureaucratic in that to say, these are your contract hours, this is where you work, and I expect you to be here. Like, you got to give a take, and I think this is where I believe we should be being that kind of being a flexible, like, leader. You can lead by example and also manage staff quite well in that sense. I also offer like planning days in that per year, 2 per year, so that way then the teams in that within themselves and that can kind of put forward whatever they wish to do or how they expect the service to run. Again, this is from community people too. It's not just from like internal. These are people that live in this community and breathe it. So again, they can bring that forth and that to us. Culture is always first. Everything in that we do, from resources and that to delivering our services to running a NAIDOC family day, because that's given back to the community, is always like culture is actually first and utmost. Look, I have also, again, open door policies because, sorry, I'm on a little roll here, soapbox moment now.
Okay, I'm going to give you 1 more minute.
Yeah, like again, like we have also like an awards quarterly award because I think you got to give that recognition back to staff and recognise that. And to do all that again, you need, and this is to retain, build morale, so then they can become better workers and that for our children and our community to do better delivery services and that within wherever you may work. That's me. I could go on for a little bit more, but I've got, obviously Lisa said that's it. Cut off.
I'm sorry. I think that you'll probably get lots of resumes to Nudge and Judge and after this webinar first. Look, Timothy and Melissa, just noting that we're running out of time, but Timothy, I just wanted to hear from you. What could the people who are listening today, what we hear a lot about the term meaningful youth engagement, but what does that actually look like in practice? And how do we make sure that they're just not empty words, but they actually translate into meaningful action? And if you can just share your one action, and we talked about it last week, and I think it was a great idea that you had.
Yeah. So yeah, as we discussed last week in the test meeting, I think to support like the caseworkers and the people who work in that offices and stuff, is because I over the years that I've experienced with foster care and stuff is if I request a certain thing, like say I wanted a new bed or something, because my old one's getting too old to sleep on, um, oh no, I did unmute myself. Okay. That when it gets requested, that it just doesn't sit there for too long because then they're gonna think that it's not being done. And so I was thinking that like maybe like having the caseworkers have an extra set of hands, like an administration, to like help them ensure that it's like flows more smoothly, and stuff like that. And yeah, I reckon that would be a really good idea. And for like the kids in like care and all of that, I reckon for the youth and that, is ensure that they feel connected more to culture as well. I say that because I never got to be connected, to culture properly. I never really, went out to my homeland. I never, like, I guess, got to like do the things that I, wanted to do. And also help them, I guess, better connect with their families because I'm still like trying to find out who my family is today. Which, I'm doing it gradually, but I reckon that's also a really important thing to take away from today is ensure that they know who their family is, where they come from, who they can turn to for support, and stuff like that. Yeah.
Thanks, Timothy. They're really, really important takeaways, and I'm really grateful for you sharing those. And Melissa, I'm going to hand over to you to give us some wrapping up thoughts about what you think we can do to make it a more sustainable workforce. I've just been told that the webinar won't close off in 2.20 minutes. You don't have to speak too quickly, and also your action.
Great, thanks, Lisa. And I think all of the points that have been made today are really important points. Ursula, on what you were talking about on those strategies that you use within your own team, and Jeanette, likewise, to recognise the contributions of your workforce to establish that sense of psychosocial and cultural safety within your teams, thinking about things like supervision and team support, all of that within the research. Obviously, the literature talks to the importance of all of that and the collaborative learning opportunities that you provide, but centering that in that view around diversity and thinking about ensuring that for all of us in all of our roles, and I'm conscious that we'll have a range of both practitioners, policymakers, probably the full way through to those with lived experience who are listening into today's conversation. I'd encourage for all of us to think about ways that we can meaningfully shift investment to those earlier supports, but also build the lived experience and peer workforce, because I think a lot of what we've talked about today and those challenges, we will be able to overcome that when we have the leaders of the next generation, like the Tims on the line, actually meaningfully shaping our sector and shaping its work. And that involves having those leadership pathways that we spoke about earlier, which are so important to really enable that shift in power. So those are my final thoughts. And there you go. And you've still got some time remaining. It looks like the clock's
I just want to say a huge thank you to the panelists for your insight and for your leadership in this sector over a long period of time. And Tim, as an emerging leader, I'm really excited to see where that path takes you. We will be able to send out some details of the panelists after the webinar, and if people want to get in touch, I'm just offering that up. Sorry that we had to cut some of that short, but your insights and your experiences and your ideas today all gave us something to think about. The voices and the solutions that you've highlighted, I think that leadership, culture, I think thinking differently, thinking outside the box were all things that I've heard, and the absolute importance of culture is really important. And I also think it's great that we just spent some time talking about how challenging these jobs are, but also how rewarding they are. So thank you for sharing your insights. Thank you for everyone who's joined in today and listened to these important conversations. Remember that every conversation matters, but every action counts too. Let's take what we've learned today and put them into practice where we can, keeping children and young people and families as our priority every day of the year. And before we go, I just want to say a heartfelt to everyone who works in this space. You are all children's champions. And I want to say an additional shout out to our Torres Strait Islander friends and colleagues who Ursula said they are never not at work. And I get goosebumps when I say that, but I actually learnt that from Ursula's sister way back in the day. And I can see you smiling because you can hear her talking to me around that. And thank you for your tireless wisdom and your energy and all that you do for making us better workers, and your patience with us all. Thank you from the bottom of my heart, and thanks to the panelists very much. Okay, thank you.
Thanks, everyone.
Okay.
Thank you.